Every 21 seconds, another American is diagnosed with diabetes, the sixth leading cause of death in the United States.
The diabetes epidemic is one of the greatest challenges facing the U.S. healthcare system today. Over 20 million people have diabetes, and this year alone, over 200,000 people will die. In addition, there are a number of complications facing people with diabetes, including blindness, kidney failure, and problems with the lower extremities.
The U.S. spends over $174 billion a year on diabetes, measured in the direct and indirect costs of emergency room visits, expensive and extended hospitalizations, disability insurance costs, absenteeism, and lost worker productivity. In an effort to address these critical issues, in October 2005, the American Pharmacists Association Foundation announced the Diabetes 10-City Challenge, with support from GlaxoSmithKline.
Through the Diabetes 10-City Challenge, employers provide a voluntary health benefit for their employees and their families, and it provides incentives such as waive copays for diabetes medications and supplies, and it also provides access to the support services of a pharmacist coach to help patients manage their disease on a day-to-day basis.
Chronic diseases like diabetes are threatening the stability of our healthcare system. By focusing on patients and helping them to better understand and self-manage their condition, we can improve their health and lower costs. So GSK is proud to support the Diabetes 10-City Challenge because it's a model that works and it can be replicated.
Today, 31 employers and hundreds of local pharmacists in 10 cities have joined together to help more than 1,000 employees, dependents, and retirees manage their diabetes.
By providing the participants their medications and supplies at no cost, we're removing any financial barriers that would prohibit them from taking control of their chronic disease. This results in improved health. Then when they see their pharmacist coaches, that's where they stay accountable for setting goals, staying on track, and learning everything they need to do to control their chronic disease.
In an interim report published in the March issue of the Journal of the American Pharmacists Association, DTCC participants improved across all key diabetes indicators, including a 21% increase in people achieving an A1C goal less than 7, more than 57% of participants achieving LDL cholesterol goals, a 15.7% increase in the number of people achieving blood pressure goals. The interim report also looked at patient satisfaction and lifestyle goals. The number of participants with nutrition goals increased from 22% to 66%. The number of people with weight goals increased from 23% to 64%. And the number of participants with exercise goals increased from 24% to 72%.
The data clearly show that when patients are supported and empowered to make the lifestyle changes that are necessary to manage a chronic disease such as diabetes, that significant clinical improvements are possible.
I work closely with each of my patients to monitor key diabetes indicators.
Hi Cecily, how you doing?
Glad you can make it today. Let's go back to the
I also educate them on diet, exercise, their medications, the importance of vaccinations, and we work together to formulate appropriate lifestyle goals. My ultimate goal is for my patients to have the skills to manage their diabetes and ultimately to improve the quality of their life.
The program is really incredible. Since joining the program, my pharmacist coach has helped me control my diabetes as well as my cholesterol and blood pressure. They help me to understand my meter readings and my current medications. We also together set up a little exercise program that I do from my home. And I just feel with the program and with the help of the pharmacist, I have more control over my diabetes, and diabetes doesn't have control over me.
In 2007, the APhA Foundation announced HealthMap RX, an initiative that offers the DTCC collaborative model of care to employers nationwide.
The cost of chronic disease in this country are nearing catastrophic proportions when you look at it in terms of clinical, economic, and humanistic costs. Programs such as the Diabetes 10-City Challenge and Health Map RX are fundamentally changing the way we manage and pay for chronic disease in this country because they align the incentives for all stakeholders, most importantly the patient.
The Diabetes 10-City Challenge, empowering people and changing healthcare in the U.S.